Hello and welcome to Masala Podcast. I am delighted to have with me Dr. Nighat Arif, who I've been trying to get on the podcast for a while now. She's a very busy lady. She's on TV. She's doing like a million amazing things. And I'm absolutely delighted for you to hear this conversation today. Dr. Nighat, welcome to Masala Podcast.
Sangeeta, thank you so much for having me. It's absolutely an honour to be here.
Let's start maybe by you telling me a little bit about kind of your background, where you grew up, how you came to be a GP and doing the work that you do.
So I have a lot of hats and my hats vary very much. So firstly, I'm an NHS GP. I live in Buckinghamshire, grew up in Buckinghamshire as well. When I say I grew up, actually, I wasn't born in England. When I was 9 years old, my father and my mother decided to emigrate to the UK. My father was already in the UK. So my father is an imam. He's the leader of the Sunni Muslim community in Buckinghamshire. I am definitely the priest's daughter. So when you hear all the things that you hear, we have those restrictions, and there's no way of nullifying that. And my mother was very young, so we moved from Pakistan. We're Punjabi. Our background is Punjabi, and we grew up around in Lahore. Actually, I was born in Bahawalnagar in a tiny village, and the village doesn't actually have a name. It's called Thatti Fateh, which is 38. So when the British were colonising in India and Pakistan, they just basically went along the river and decided to name all the villages by numbers because nobody had time to give them a name.
Couldn't be bothered to give them names, yeah.
As those were the times. And so I come from Thatti Fateh, that's where I was born, in a beautiful mud hut, which is no longer there anymore. And I came over with my mother, my brother, Irfan, and my other brother, Imran. So my mother came over with 3 children to a wet and cold and a miserable England. So my father had told my mother, don't worry, we're going to go in April. So it'll be fine. The weather will be beautiful. So my mother had got me in a lovely summer dress and I was wearing flip-flops. So my very vivid memory of arriving in England is standing at Heathrow Airport and it's pouring it down in a summer dress which is sleeveless and flip-flops, and just standing there and going, oh my goodness, where have I come from? Because the summer and the spring in Pakistan is a totally different thing. And we grew up on farmers. So we're subsidy farmers back in Pakistan. Anyway, got integrated into the education system here and went to school, learned how to speak English. And I was the first person to speak English in my family because my younger sibling. So I would be the translator for my parents. I'd even translate my own parents' evening to my parents. And then I just thought, you know what, I want to do something that I adore. And there was a GP who actually I'm still in touch with, Dr. Rachel Firth, who I just thought she was phenomenal. She was this serene being in her GP surgery. We'd go to her. She was just so knowledgeable. And I just thought, that's what I'll be. I want to be a doctor. There were loads of other reasons why I wanted to be a doctor. Then went to the Misbourne School, got my A-levels, and went off to university to Barts in the London and did my 5-6 years of my medical training, and then got married, left that in sort of life in London, moved back home to Buckinghamshire. In fact, 3 doors down from my parents. So my parents live only 3 doors away. I'm a very typically Punjabi Pakistani girl. And then did my training, which is F1, which is junior house officer, F2, and then I did my GP training and then qualified as a GP in 2010. So yeah, it's nearly been, I think, coming up to 11 years that I've been a GP. And within that, I've developed a specialism. So I'm a GP with a specialist interest in women's health. The pandemic hit. And then when the pandemic hit, by accident, I ended up on TV. And then by accident, I ended up with a radio show on BBC Three Counties Radio. And by accident, I started doing social media and TikToks and whatever else that comes with it.
I'm sure it's no accident, Nighat. I think every time I've watched you either on TikTok or heard you speak, you are so passionate about kind of women's health and the menopause and all these kind of specific issues that you talk about. So I'm sure it's no accident. But I love that image of you standing at Heathrow Airport in your summer dress thinking, oh my God, this is really, really cold. I absolutely love that. Thank you for sharing that. Let's talk about the menopause. Mm-hmm. First of all, let's talk about why is it such a big taboo?
It is a taboo, and it's been historically taboo because there's a lot of stigma and shame attached to the symptoms that come with it. Women's bodies are traditionally sexualized, and I'm going to call it for what it is. We do have medicalized misogyny and the patriarchy that plays a huge role. And I don't need to tell you about that, or your listeners, about the patriarchy and misogyny, because that's what your podcast highlights beautifully. The issue that we have is when you've got symptoms of vaginal dryness, or you've got symptoms of low libido, you've got issues around pain and aches and pains, and then you've got the psychological symptoms of the menopause. And there are over 42 different symptoms of the menopause. The idea of us getting older is something that's so hidden. And then if you transpose that into a community where women's bodies or anything regarding gynecological bits, so even a breast exam is sexualized or periods are sexualized, then you want to hide those changes that you're going through in the midlife even more. And then on top of that, then you've got a shrouded, internalized misogyny. So women don't support women. And so they'll say, well, I went through this and I had no issues. Why can't you get through this? And so that shrouding of everything staying underneath the veil remains. So in Punjabi, हम कहते हैं जब औरत का एहसास नहीं करती. That basically means when a woman doesn't support a woman, then actually you just stay silent. Or जब हर चीज़ पर्दे के नीचे रहती है, everything that stays underneath a veil. I'm hoping your listeners are speak Punjabi.
I think a lot of people will.
So when that aspect remains, then there's an area of silence. And when there's an area of silence, then I, as the doctor, don't know. Because I learn from my patients, and as researchers, as doctors, we only come across conditions or symptoms because patients come and tell us. That's the whole point of medicine. Medicine is not a science always, it's an art. And so when a woman comes to tell me, I don't have that knowledge base as a doctor to say, actually, all these symptoms could be related to the menopause. And the woman doesn't have the knowledge base because the doctor says to her, oh, this is just getting old. I had a conversation, in fact, just 2 days ago with a woman, intelligent, absolutely intelligent, lawyer, barrister, highly intelligent, grew up in this country. And she goes to me, "Tu menopause diyan gallan kyun kardi rehndi hai? Eh budhapa hai." Which basically is translated, why do you talk about the menopause so much, Nighat? It's just getting old. It's old age. Sadiyan dadiyan, our grandmothers, our aunts, our mothers went through this, and we never had an issue with it. Nobody ever spoke about it, and they've done absolutely fine, and they've lived till the age of 80. My answer to that is this. When we don't actually recognize the symptoms, then a woman suffers and suffers in silence. So we've actually done a disservice to your mother, your grandmother, your aunts and your cousins and all the women before you. What we should be doing is not a disservice that carries on, because the symptoms are actually related to long-term complications, and now the data and the study shows that. And the other thing that we found in South Asian communities is actually we are far worse off when it comes to the symptoms. So I'll give you some statistics. In the perimenopause, which is the 10 years leading up to the menopause, so that's 1 year. So menopause is 1 year when you don't have a period. Perimenopause is you're still having symptoms and you're having periods. So the symptoms are hot flushes, night sweats, irritability, palpitations, tinnitus, change in your taste smells, change in your smell changes, change in your smell happens. You get bowel changes, you get aches and pains, vaginal symptoms, recurrent urinary tract symptoms, and then the psychological symptoms that occur: loss of self-confidence, loss of self-esteem, loss of joy, depression, tearfulness. And so those symptoms, we know, especially when it comes to hot flushes, puts you at higher risk of having cardiovascular diseases. So women don't know that actually I can protect myself. 40 or 42 or 45 isn't actually being old anymore. And when those symptoms occur, you're impacted in the workplace. So 1 in 10 women consider leaving their workplace. And do you know what? That's even more so within our ethnic minority and black women. So women are leaving the workplace because of this. They're financially then not getting up into the levels that they want to do. They're leaving their workplace where they could have had now the experience to have a managerial role, to be able to say, these are the changes that I want, but they leave. So we've got a girth of individuals who aren't filling those spaces, and there's no inclusion where decisions are being made for you because men are left, or those that hang on are left. And so actually we never move forward beyond that patriarchy, beyond that misogyny, because it becomes the butt of all jokes. And the difficulty we have at the moment is that when you have all of this in the perfect concoction, it becomes difficult to talk about the menopause.
Absolutely. And I think going back to something you said, so if within the culture, South Asian culture, we don't really talk about our bodies, we don't talk about
No.
sex, we don't talk about breasts and vaginas, and these are just never discussed.
We don't have
So
words.
We don't have words, and this is something we come
Yeah.
up a lot. Like, I don't know the word for breasts or vulvas in Malayalam or Punjabi, I'm sure. Maybe they exist, but it's not part of our lexicon growing up. So if you don't refer to anything like this, how are you going to then talk about something that's difficult within that, like the menopause, right?
Yeah.
And I think the other thing that occurred to me when you were talking was that women thinking that, oh, if I've been through this, it's a very, I think happens with other women as well, but particularly South Asian. Say if you've suffered within a family or a relationship, you're like, I've done it. So this younger person's coming along now and saying that, oh, that doesn't work.
Yeah.
Like, if I've done it, why can't you put up with it? Which is also another thing. And I just feel like it makes something that doesn't need to be this difficult.
No.
And the other thing that struck me is, like, when you were talking about age, maybe our grandmothers at 50, their lives were pretty much over. Maybe they had kids, they got married at very young, they had children, they had grandchildren, and they were considered old at that point. Like we, women in our age, we're in the prime of our lives. We're like working and we're doing things. And those who have got kids, they're in the middle of a very busy life.
And the concept has to change. Like, for example, I don't understand why we have this limitation within our mind that a woman that goes after, barapa is the word that they use. I hate that word. It's such a horrible word to say aged.
Yeah.
Barapa, who says that?
Yeah.
But we do say it.
Yeah,
we use it in our language all the time.
Yeah.
We have a word for that,
Yeah.
but we don't have a word for menopause. I
Yes.
mean, in Punjabi, it's like banji, which means barren. I mean,
God,
that's
isn't that
literally
awful?
It's like, or we use English words to transpose them and it's like really awful derogatory words to describe a woman's vagina. I mean, we don't have a word for vagina or vulva. I mean, unless they're really rude swear words.
Yes.
To throw at
Same
each other.
here. Like, I don't know in Malayalam what the words are. I've just heard the really rude words. I
Yeah,
don't know what
same
the
here.
actual words are.
Same here. And I don't want to repeat those
Yeah,
on a
yeah,
podcast
they're
because they're
awful.
offensive. And
Yeah,
that's not how we
exactly.
should be sort of limiting women to that because I'm sorry, but all of us came out of a vagina.
Exactly. If it weren't for a vagina, none of us on this planet would be
There's
here.
a really lovely meme that I saw that said, everybody has had, so there's a woman who says, my vagina is so precious that I've brought life from it. I've had enjoyment from it and I've given my partner enjoyment from it. So why am I not looking after it? And I just thought to myself, that is so true. In fact, we hurl abuse at each other
Yes.
because of a woman's genitalia. Maybe not to a degree that we use male genitalia, but we do, and we
Yes.
shouldn't. And this concept that if you're over the age of 40, especially in the South Asian culture, is sex is no more.
Yeah.
And the
Yeah.
idea that a 60-year-old or a
Yeah.
70-year-old,
Yeah.
or God forbid an 80-year-old is
Yes.
having sex is like, oh my goodness.
Yes.
Because what we do is we hide behind faith. And
Yeah.
so when there are problems within those departments, they say, you haven't prayed hard enough, or you haven't asked for forgiveness, or you've done something. And unfortunately, we still have that within our culture. But I'm missing the point, the fact that sex is so important and it reduces so many other health conditions and it's vital for a couple. So I often see Asian couples in my surgery. And the uncle will come in and he'll say to me, my blood pressure's been so high, my diabetes is out of control. And if you dig a little deeper, which I've started doing with some of my patients, and I'll say to them, so how's everything at home? Is your wife okay? And he'll say, well, no, we don't sleep in the same bedroom anymore. She sleeps in a separate because she gets very hot at night, or she's always complaining of headaches, or she's always complaining of aches and pains. And that's the other thing I've realized, that aches and pains, and pain is verbalized a lot more in South Asian
Yes.
women or even black women because that's seen as a physical thing.
And it's
Whereas
more acceptable.
It's an acceptable thing, whereas psychological symptoms are still, if pagalpan ho gayi hai.
Yeah.
How many times have we heard that just growing up in our house where we've described a woman in our house as she's lost her marbles.
Yeah.
She's over the top. And unfortunately, I recognize that in my aunts and my grandma. And I'm saying to everybody, this is the menopausal symptoms. They're like, no, she's getting old. And the concept that a woman should have a vitality or enjoyment to her life, like men do. Men, we always say, oh, they age like a good wine. Women, it's like over the age of 30 and they're like, she's done for,
Yeah.
which is absolutely ridiculous. And now modern medicine women have decided to come forward and break the taboo. Muslim women like myself are saying this has got nothing to do with faith. Okay, your faith isn't being tested because you have these horrific symptoms. What I need is treatment, and now women are demanding a change.
Absolutely. And I think women like you are at the forefront of this, and I'm so glad to see the work that you're doing. I wonder if we could unpack for our listeners what the menopause and perimenopause is and what the hormonal kind of, the various hormones that play into it. Because a lot of women will say, oh, it's nothing to do with me. It's like something that happens, like most women that I speak to will say, oh, it's something that happens to really old women.
Yeah.
Without really thinking about, like, we're all at some stage of this process.
Yeah.
And we're going to have to find a way to understand it for ourselves and also take steps to kind of fix it if there are issues. So could you just explain to listeners what this whole process is?
So the first thing is there's no age limit on menopausal symptoms. So those are the symptoms that I recalled earlier. And you can have them with periods and without periods. If you just look at the definitions, and there is a whole range of definitions. So we have perimenopause, which starts roughly around the age of 40. The symptoms get worse and you notice them around the age of 43 or 45. And so you have a reduction in estrogen and progesterone. So those are the hormones that our ovaries produce. Basically, our body just says to us, look, you've done your fertility years. Now you don't need these hormones. I'm going to reduce them because you're in the next phase of your life. We transition as women all the time. We go from, birth all the way up to puberty, and our hormones change and we start our periods. And then when we're in our periods, we have pregnancies, and every single time you have a pregnancy, you're breastfeeding, your boobs get bigger, then they go down again. And then your periods come back. So those are your fertility years. And then you hit the midlife, which is when another transition happens because, well, you're past your fertility years now. And so what happens is you get a reduction in estrogen and progesterone and then testosterone as well, which is the third hormone. Now, when you get a reduction in these hormones, estrogen is really important. What it does is I always describe it as, look, we need this because it lubricates our blood vessels. So from our head to our toe, around our heart, in our brain, around our kidneys, our gut, everywhere, it actually lubricates everything. Estrogen is an immune modulator. So it helps the immune system fight off stuff. So we have difficulty fighting off infections when we're later on in life. And so when these hormones are fluctuating, this array of symptoms happen. And this can be a decade before you hit the menopause. Menopause is 1 year without a period. Post-menopause is 1 year and 1 day without a period. But unpacking that further, you could go into the menopause really early. 1 in 100 women go into the menopause below the age of 40. So the youngest girl is, I think, about 15, and she's got primary ovarian insufficiency. Basically, the ovaries, we don't know the cause yet. We think there might be a genetic cause or a biological reason, but the ovaries stop working. So a 15-year-old in this country has menopausal symptoms. And then there's such a thing as surgical menopause. Now, surgical menopause is when you've had surgery to remove your ovaries or your womb, so known as a bilateral salpingo oophorectomy and a hysterectomy. And if you have your ovaries removed, you're plunged. That's it. The day that you have it removed, straight into the menopause. And then we also have chemical menopause as well. So chemical menopause is we've given you something, say you've had some cancer treatment or something like that, and that's plunged you into the menopause. And the symptoms arise because of that. So it's not so straight cut as this is, old women. And unfortunately, it's always packaged in a Western voice. Yes. It's rich older women who are saying, look, I want my hormones. No, actually, this is a medical condition that happens to even younger women, and there are different facets to that. And that's why HRT is vital for those women who are having a loss of their hormones.
Absolutely. And I think this is something I really want to emphasize, that it's not something that happens to white women. It's not something that happens to really old women. It's going to happen to every single one of us.
Yeah.
And the symptoms, correct me if I'm wrong, can start from around 40.
Yeah.
Yeah. And things start to change, and estrogen levels start to drop and progesterone levels start to change, right?
And they don't all come at once.
Exactly. It's not like one fine day you're off the cliff and there's menopause,
exactly.
Right?
Women don't just find that they just happen. Our bodies are fabulous. So if you think back, when you were going through puberty, you didn't just suddenly one day start having your periods. It might have felt like that, but actually your body was subtly changing for maybe 5 or 6 years before that. So your boobs start to develop. You've got a little bit of puppy fat around your hips. Your hips started to develop as well. You might have noticed that your hair consistency was a little bit different. Your skin had changed a little bit. Your mood was fluctuating. And then suddenly one day, you saw red as you pull down your panties or panty liners. And so, that is a period. But that happens. The same thing happens on the other side of life as well. And the concept that we have is that, well, women say, but these symptoms happen, but it must be something else. A lot of women that I see around 40s and 50s is when they've got stresses, they're looking after their parents who are older. Everybody runs to the woman in the house, don't they? I mean, I'm a doctor, but I still find that everybody will come to the woman. No matter how illiterate she is, they will still go to her for advice, especially when it means maternal care and medical care. So you're looking after your parents. Your kids are now older and you're thinking, "Main ki shadi karni hai. I need to get them married off now." And arranged marriages still work in a lot of South Asian communities. You now sort of are finding your feet in your career, the career that you worked so hard for. You've done your periods, you've done your pregnancies, and God forbid, you might have gone through miscarriages and all the complications with birth. Now you're on the other side and you're in your 40s and you're thinking, right, I'm at my realm. I'm the most experienced person at my group. And then the menopausal symptoms gradually come and we dismiss it because they all come as these hodgepodge symptoms. And this is why we've always had a difficulty of actually diagnosing it or even doctors being aware of it and giving that a consideration as a differential diagnosis.
Absolutely. And I think the thing that I wanted to talk about personally for me as well, I've only just figured that I was perimenopausal, like about 4 years ago, suddenly got hit by really bad UTIs constantly and kept going to the GP and he kept putting me on antibiotics and all the usual cranberry, this, that. It's only now that I figured actually it was perimenopause. And I think because there's such little, we talk about it so little, we talk about it so less, that these, now I know they're fairly common symptoms. It's not an unusual symptom to have recurrent UTIs. That's like indicative of the menopause, perimenopause. I remember saying to my GP and he's like, no, this is not it because, your periods are normal, whatever. And I think it's so important, therefore, to kind of bring it back to what the work you do and to talk about the symptoms like you've talked about, to talk about the various hormones in our bodies and the role they play. So you talk a lot about HRT, I think. Now, within South Asian communities, the women that I've spoken to, everybody goes, "Oh my God, HRT, cancer." Like literally, I've had this conversation.
I think every community does that. Don't worry.
So it's not just us then. Great.
But it's more so within our communities because we have even less knowledge about HRT.
Yeah.
But I wanted to go back on something that you just said earlier there. You said you got recurrent UTIs. And I think we've done a massive disservice in medicine when it comes to UTIs. It's not seen as a sexy subject. Urinary tract infections, a cardiologist who's there.
Saving lives.
I'll tell you a very, very quick story, actually. And this is a side point. I was a medical student and I was going on a ward round and we had a very, very famous cardiothoracic surgeon. And surgeons have a huge ego about them. And cardiothoracic surgery is basically you do surgery around the heart to fix the heart, put it back into the chest. So technically the patient is dead for a little while all this surgery is happening. And then the patient gets better because they have lots of valve surgery and things. And we were doing a ward round. And this is back in the days. I mean, I hope they don't do ward rounds like this anymore. And a long corridor of patients have been eagerly waiting for this consultant to come through. We all are chasing his coattails as medical students because you've got a whole team, junior doctors, SHOs, registrars, research students, and then you've got the piddly medical students, which is me. So we're running after him as he's doing his ward round. And this gentleman puts up his head from the end of the bed, which is the patient, and he goes to the patient, he goes to the consultant, am I going to be okay out of this surgery? Because I'm really scared about having this cardiothoracic surgery. And he looked the patient in the eye and looked around at our group and he goes, "Man, there are only 2 people who can save you right now, God or me. And frankly, God isn't here." I mean, the ego,
God, the ego,
the ego and just the facade. And we were all stood there going, whoa. And that is so hot and sexy, to know that you can do a profession where you can literally, put someone to death. And then you've got UTIs. What do you do? I look at we all day.
Talk about we all day.
So the concept that you have around what's sort of hot in medicine and what gets funding or what gets research is so based on sort of this sort of ego. And it is ego when it comes to medicine, unfortunately. And so we've done a huge disservice to women. But there is genitourinary syndrome of the menopause or vaginal atrophy, which as you lose estrogen, and we've got estrogen receptors everywhere. If you recall, I said, look, it's like a lubricant. We need it. And we've got receptors everywhere. And we've got lots of receptors around our vulva and our bladder. And so that bit of skin needs that love and tenderness and care, because when you lose that estrogen, the sort of the receptors, they shrink, and they shrink in size, and they shrink around the bladder and the urethra where we wee from. Unfortunately, or well, fortunately, our anatomy as women is that our sewage works and our water works and our sexual orifices are all exactly in the same place. And so what happens is you get transmission of bugs. So E. coli, which is a bug that lives very, very commonly in the back passage, will transmit if you don't have that level of coliform or protection, or the pH is out of balance, hence why UTIs are so common in perimenopause. So if a woman is in her 40s, I mean, I wish I could do this with every woman. I would say to her, look, as my birthday gift to you, to stop you from getting genitourinary syndrome of the menopause symptoms, such as vaginal dryness, vulval splitting, overproduction of vaginal secretions, itching, soreness when you're having sex, soreness when you're having smears, or, prolapse symptoms, recurrent urinary tract symptoms. So all of these symptoms are the GSM symptoms. I'm going to give you vaginal estrogen. Vaginal estrogen, HRT, will replenish the skin cells in and around the vagina and the bladder, make sex so much easier, stop your UTIs, stop this recurrent need of antibiotics, which makes you feel horrific. And that is the treatment for it. How often do we do that?
Never.
Yeah.
Like never.
And we don't. And the thing is there's this fear around HRT.
Yes.
So I wanted to unpack the next bit of your question, which was, well, why don't we have HRT? Okay, so HRT has gone through so many rigmaroles and different things. There are 3 letters that just mean hormone replacement therapy. So we talked about hormones which fluctuate and you basically deplete or get less in. And all you're doing is you're just supplementing yourself with hormones. We do that with hundreds of other conditions. So if you have a thyroid problem and you're not producing enough thyroid, what do? We give you thyroxine just to supplement what you're not making so your health is better. People who are, say, type 2 diabetics and they are having insulin resistance and they're not having enough insulin, what we do is we give them insulin if their control isn't. And, type 1 diabetics, we do exactly the same. It's just supplementation of a hormone. And all we're doing with HRT is giving that back. But the problem that we've had is that because of lack of research, lack of randomized control studies, various studies which have been now deemed to be inaccurate, have the headlines passed around on media. So the WHI study showed that women who were on a synthetic, so artificial made estrogens, they had a higher risk of breast cancer. Now, I wanted to unpack this a little bit because women don't understand sometimes, I think, breast cancer. So your risk of getting breast cancer in the UK, according to Cancer Research UK, is 1 in 8. So as you get older, because breast cancer is a disease of age, though your risk increases. Why? Because the estrogen that we produce as women works on the breast receptors. I'm touching my breast right now, but I have lots of receptors in my breasts, and those receptors will change every single time I have a period. So your boobs become a bit sore and tender. Where you get inflammation, you'll get change. Where you get change, you'll get mistakes in cells. And unfortunately, those mistakes can turn into cancer. So this whole thing about estrogen receptor cancers, well, of course, because your breasts are loads of estrogen receptors in there. And so it's a tragic diagnosis and it's life-changing and life-altering for so many women. But what the study showed that women who were exposed to synthetic estrogen, well, actually their risk increases. And then we had the Million Women study, which sounds like oh my goodness, a million women, they studied that many women. Yeah. But actually that Million Women study was a retrospective study. So what they did is they looked at older women in the study and then just sort of picked out the fact that, there's risks attached to clots or there's risks attached to breast cancer. But actually, it's a disease of age. So if you're looking at a woman over the age of 60, unfortunately, she's going to get breast cancer. Was it the HRT that she was on, or the fact that it was her age? A woman who's a smoker, she's going to have a higher chance of breast cancer. A woman with a BMI, a body mass index of over 30, has a 50% higher chance of getting breast cancer. A woman who drinks more than the recommended limits, so 14 units of alcohol a week. So if she's drinking more than that, she'll have a higher increased incidence of breast cancer. So when you're looking at studies, are you just looking at HRT that she's on, or are you looking at the other
lifestyle factors,
or her other age, all of those factors, her body weight? Are you looking at those factors as well? And unfortunately, what happened was that the studies showed that there were risks attached to it. HRT's moved on.
Yeah.
So hormone replacement therapy, we now know there's body identical hormone replacement therapy such as patches or gels. And in younger women, so below the age of 60 or, in perimenopausal age, if they start taking HRT, estrogen HRT, so as a patch or as a gel or a spray, then actually their background risk doesn't increase. Yes, there's a little bit of risk of breast cancer, but it doesn't increase massively. And in younger women who don't have a womb, if they're on estrogen only, then actually they don't die from their risk doesn't increase, and they don't die from HRT related breast cancer either. So in fact, you're getting all these benefits. Your quality of life is better. Your rate of depression decreases. Your rate of heart disease decreases. Now there's even data to suggest it could be protective against dementia, and it could be protective against, it's a treatment for osteoporosis, which affects a lot of South Asian women. So those benefits, we need to be saying, look, these are the benefits of HRT, and those risks that you're there, actually the risks are there anyway. And so do you want a quality of life, or do you want a quantity of life? And so that balance, that risk and benefit, has to be very individually tailored to a woman. And then on top of that, not just body identical transdermal estrogens, we've also got topical vaginal estrogens such as Vagifem or Vagirux. And that topical vaginal estrogen, the data and the studies have shown that they do not increase your risk of breast cancer and do not increase your risk of recurrence of breast cancer. So even if you've had breast cancer, you can be on topical vaginal estrogen to stop things like recurrent UTIs.
This is absolutely brilliant. And I wish someone had told me this 5 years ago. Because, this 4 years of this constant antibiotic
We've
popping,
done you a disservice. And we're doing a disservice still.
Exactly.
Because this message isn't going out to Asian women, Black and Asian women. And there's this health inequality. And I think this is why I talk about it. And I do get people going, well, why? This is Bisharam. Why are you talking about Bisharam things? Because who wants to hear about vaginas? But it gets me because, like you say, 5 years you struggled and you didn't need to. Isn't that? It's heartbreaking. It annoys you. It makes me angry.
It makes me really angry. And it's not that, I work in feminism, female pleasure, sex, whatever. But even me, with all the reading that I do, didn't connect the dots. And even when I connected the dots, the GP didn't take me seriously. Because I was the one who said, I think maybe this is perimenopause, because I read that the UTIs happen. And they were like, no, that's not what this is. So, it just makes me really, really angry, this, I think.
So if we look at that and we look at the data around ethnic minority women who seek help in the NHS, actually we are doing them a disservice. And I keep using the word disservice. It could be worse than that. But we know from the Marmot report, the 10-year analysis of ethnic minority women, we know from countless maternity reports for outcomes for Black mums, 4 or 5 times higher risk of miscarriage and death to Black mums and complications. And we know that there is, the SAGE report that came out in the pandemic, which showed that Black and Asian ethnic minorities were far more disproportionately affected by COVID. This is in our life, 2 years ago. I'm not talking about something that's even old. Yeah. The fact that we have these health inequalities is underpinned by institutionalized racism. That's not even me saying it. This is SAGE saying it. Yeah. So when we know that there are issues, unfortunately, this is why we have even more the fact that ethnic minority women are far more disadvantaged when it comes to things like women's health and menopausal care and menopause assistance in the workplace and just their quality of life. So then the statistics will come out and say, well, why are ethnic minority women, for example, dying 10 years younger than their white counterpart? Or why are we having more mistakes in ethnic minority women. And I always get the same answer from the women that I ask. They say, well, the doctor didn't take me seriously. And then you ask the doctors and you say, well, why aren't you taking these women seriously? And they'll say, but the symptoms didn't fit the profile that I'm used to. Why? Because we are researching white Western women.
Exactly.
And we are transimposing them into our ethnic minority women and saying, but you're all the same. I mean, women are women. I don't know, don't get me wrong. I'll ask you a thing and guaranteed I'll ask you any intimate gynecological problem. Even if I wasn't a doctor, you would tell me the truth. You will tell me, Nighat,
of course,
I have this, sex is this, I have these issues.
Yeah.
And I'll say to you, what do you want from me as a doctor? You will tell me.
Yeah.
The problem that happens is that I'm blinkered because I will look at my Western books. So only now are we seeing coloured images of women in their pregnancy state or eczema rashes in black communities, or how like I'm still trying to source a video of lichen planus and lichen sclerosis around the vulva in coloured women, and I can't find it in any medical textbook. That's a textbook that I grew up with learning because it's always Caucasian white skin.
Yeah.
So how dare we then as doctors say, well, actually there's less good outcomes for ethnic minority women? Because actually what there is that there's this institutionalized racism because we've never shown doctors in this country, well, these are the symptoms. And it was only when I started tracking some of the women I look after, because I worked in Slough and Southall. And I had a colleague of mine, a Pakistani colleague, who said to me, there's a patient that was coming in recurrently with abdo pain, and it turned out it was endometriosis. And that's another bugbear of mine that I have with my Asian patients, because I think it's criminal, the fact that we miss endometriosis for 7.5 years, and worse so in ethnic minority people, because there's this concept that women of colour are better with pain, or they don't feel pain to the degree. I know.
I can tell you we feel pain.
It's shocking. And that stems from times of slavery when, Dr. Sims, who brought out the Sims speculator, he was saying that they experimented on black women, saying women don't feel pain the way that white women do, and they have a higher pain tolerance. Look, that is utterly ridiculous. But unfortunately, that I've heard that in medicine. And I had a Pakistani colleague who said to me, ये आ रही है हमेशा इसके पेट में दर्द होती है. She's coming, she always has pain in her stomach. Bibi Begum syndrome. And I was like, ये क्या होता है? What is this? Grown up in this country, she had come from Pakistan, had done her plabs and things. And I said to her, what is this? And she goes, oh, जब औरतें आगता हमारी community से आती हैं, बस हमेशा उनकी दर्द ही आगता हम संभालते रहते हैं. सर से लेके पैरों तक दर्द होती है. So women who from our culture who come in complain of head to toe pain. And वो आगता क्या जिन्हें नखरे कर रही हैं. So they're over exaggerating their pain. And I was mortified. And I'm not even talking, this was years ago. This was maybe 3 or 4 years ago.
Yeah.
And I was literally livid. Because the thing is we have colonialism, which plays a huge role in the way that we perceive women. औरत का साथ नहीं देती. Women don't support each other. And we have this thing that the white individual who has taught us this medicine is the right way. Yeah. So we don't question it. So I put it on Twitter. Yeah. So I took to Twitter and I said, I'm seeing lots of Asian women who are in my clinic, and they come in and complain of aches and pains. They don't complain of flushes. I say to a woman in Pakistan, from Pakistan, आपको गर्मी लगती है, flushes होते हैं. वो कहेगी गर्म मुल्क में खलो, पाकिस्तान की heat में खलो. They'll say, if you feel flushes, so if I say to a woman, do you get flushes? She'll say, stand in the heat in Pakistan. It's 45 degrees. You'll know what a flush is, because the concept of flush is in there, but she'll tell you about aches and pains. Yeah. And so when you look at that and you think, oh my goodness, that is absolutely right, because your symptomology is slightly different and we've never documented this. And then I put this out on Twitter, and then I had loads of other doctors going, and doctors from India and Bangladesh going, we get the same thing, because they don't complain of flushes so much, but they complain of aches and pains, recurrent UTIs, loss of libido, loss of desire, mood-related symptoms. And hum to kehte hain they're old. What we say is because they're older. And we ask them to pray harder. Isn't that awful?
It's just terrible. It makes me so angry.
It makes me so angry. But how have we, allowed this as a society within ourselves as women? You're an incredibly intelligent woman, Sangeeta. I follow you and I think you do an immense amount of work, and you're not afraid to talk about anything taboo, which is why I adore you. But yet even you felt that the doctor didn't listen to you.
Exactly. Because when I go in
So
there,
imagine a woman who doesn't
yes,
speak English.
I was just about to say that. I'm like, okay, I've looked it up and I've read it up and I've done my research, but I still turn up. And when it's a GP, it was a male GP, when he says, I don't think that's what it is, I just say, okay. So why am I not questioning it? So I think that's that internalized.
Because we have that concept within us, that
Exactly.
internalized sort of power level.
Yes, exactly.
Doctor sab kuch sahi kehta hai.
The
The doctor's always
know
right.
everything.
Yeah,
exactly.
yeah. And so for the one thing I always say, and I laugh at this because I'll get women who'll come and say to me and they'll be like, Doctor jo kuch tum kehti. And I'm like, no. This is a conversation.
Yeah.
I'm not right.
Yeah.
You have to tell me what you want. And they'll say, but I don't know what I want. And then the best consultation is you give them an option.
Yeah.
And I show them all the options and I say HRT, no HRT, actually localized vaginal estrogen, diet and exercise. Which of those would you want to try first and then try it and then come back to me?
Yeah.
And that is shared care.
Absolutely.
The shared care plan or that concept doesn't exist. But what's happened is we've educated that plan as doctors in the NHS to know what services to get to our Caucasian population. So then 10 years down the line, the Marmot report comes out going, oh, ethnic minorities do far worse outcomes. Well,
like,
you've never taught
really
the communities.
Surprising. Why is that?
You've never taught the communities how to use the services within the NHS. They don't realise that they have 10 minutes. They don't realise that actually there are interpretation services that they can have. Language is a barrier. Then their cultural heritage is a barrier. Then the shame that is attached to it. The fact that they might not want to see a male GP. They're waiting for a female GP. The number of times I still get message from women going, I've got a breast lump and can I wait to go and see a male GP, Dr. Arif? And I'm like, no, you see anyone. Like, you need to get this tested. And it's only now in 2022, because, and even this is my own lack of understanding, is that Ramadan has just happened. Ramadan has just happened. And now women are more aware of HRT because of Kate Muir's, a genius woman, Kate Muir, her documentary, Davina McCall's Sex, Mind and the Menopause. If you, to the listeners, I say, please watch it.
You have to watch it. It's absolutely life-changing, I think.
And the first one, Davina McCall's Sex, Lies and the Menopause. The second one has come out only yesterday, Davina McCall, Sex, Mind and the Menopause. And it's brilliant. And the thing is, it blew apart this concept because they had Karen Arthur on there. I was on her first documentary talking about women from South Asian heritages and getting posters in Urdu for women in our community. And the amazing thing is now more women are going to HRT. And when they go more for HRT, is that they are suddenly feeling empowered about their health. So I really do feel that the future is bright as we go forward. I really
think this is a really good time. And I feel like there's a synergy of that documentary that we saw yesterday, this talking to you, all the work you do. There's something I wanted to touch upon, is the psychological impact of the menopause, which I don't think we talk about. So most women think menopause, they think hot flushes, right? That's the thing and if you don't have the hot flushes, you're like, oh, clearly I don't have the hot flushes, so I'm not perimenopausal or menopausal. But that's not truth at all, as all the things you're saying. But I think the psychological impact is something that's really not discussed. So suddenly, and again, this happened to me. And now looking back, I can pin it on together. So 4 years ago, suddenly depression, anxiety, out of nowhere. And it was like a car crash is what it felt like. And speaking to other women who've experienced similar things, again, it's the perimenopause, menopause. Can you talk to us a little bit about the psychological impact of what happens when the hormones go,
Yeah, of course. So this was actually really well explained last night. So in perimenopause, I'll just tell you some of the statistics. So perimenopause, at 10 years before you hit the menopause, and even in the menopause, 1 in 4 women will say, I had some symptoms. 1 in 4 women will say, I had no symptoms. 2 out of 4 women will say, I had some symptoms, flushes, night sweats, some psychological symptoms. 1 in 4 will feel suicidal. And I've seen that. I've seen that walk through my door where a woman is at the end of her tether. She's probably been to different GPs at the practice and they've offered her antidepressants. And she's not, because she's actually just going through perimenopause. She's on her knees and she'll say, I wanted to drive the car off a cliff yesterday, or something stopped me, or the sound of my kids' voices. And that breaks my heart, and it's horrific. And it's even more horrific, the fact that we don't acknowledge this within our community. And the psychological symptoms, as you were saying, are overbearing. So it's that low mood, tearfulness, the memory fog. You know, याददाश्त इतनी
Yes.
अच्छी नहीं रहती. You don't remember things so well. You lose confidence. You lose lack of self-esteem. You don't feel sexy, so your libido is not there, so you don't want anyone to touch you or talk to you. Irritability, anger. How many aunties can you think of who are in their 40s and 50s and 60s that you think, oh, हमेशा गुस्से में रहती है? Tell me.
Loads,
loads.
actually, with a Belan.
Yeah, exactly. With a chappal.
Chappal and Belan.
I honestly can think of, I went to a wedding recently as we came out of the pandemic, and now, obviously now I'm not so blinkered anymore, but I saw so many women and they were just angry. They were just, for no reason. They're just irritable and angry and wafting a fan and sitting there and just going, oh, garmi lagti rehti hai. And I was just thinking, this is
my
menopause.
God, this is classic.
And then they'll say, I'm insomniac. I can't sleep. The sleep symptoms is horrific because if you're not charging your batteries, you're feeling awful the next day. And then on top of that, you're so on edge that you feel like this is never going to end. It's 10 years of this.
Wow.
And how is this going to end? Because the hormones are fluctuating. Estrogen lubricates those blood vessels around the brain. So we now have realized, I mean, we knew that hormones affected our mood. We know that for our fertility years. We know it affects pregnancy. We know that very, very well. We've got so much stuff around how to look after your mental health in pregnancy. What, do you think the woman just falls off a cliff at the age of 40? Why aren't we doing this for perimenopause?
Exactly.
It's ridiculous. It's like this is where I came back to patriarchy and misogyny, because a woman's role is only to have bache banana or bache banana.
And that's it. Like, as soon as you've done it, you're like, job's over now. We don't really care about you.
So we don't really care about you. You're surplus to excess. So those psychological symptoms are worse. And for some of my patients, actually the only thing that they get are psychological symptoms. So the first line treatment, and this is according to NICE, is that we should be offering women HRT, hormone replacement therapy, and getting their estrogen level balanced right. It's not like the silver bullet. So like I'm talking about HRT as, you know, all the benefits of it. I don't want the listeners to think, do you know what, this is amazing, this is what I need. But it's a part of the jigsaw. A great exercise, great diet, weight-bearing exercises which help the mental mind and also your physical strength as well. And talking to friends, seeking help when you need help. And those are the things that you should be resorting to first. Unfortunately, because there is so much myths and fear around HRT, which we talked about earlier, doctors don't want to prescribe it. Women don't want to take it. I actively get women who come in going, oh, no, I don't want to have HRT at all. Because A, they don't believe that they have psychological symptoms, number one. And B, they don't believe that this is the menopause. They think it's just because they need to pray harder. And I keep coming back to this because this is a concept that I constantly get. As an overtly Muslim woman who wears a hijab, the first thing they'll say to me is that, अच्छा मैं ये दवा पढ़ लेती हूँ और मेरे लिए दुआ करना डॉक्टर आरिफ. And I say, मैं तुम्हारे लिए दुआ करूँगी. लेकिन even Hazur Pak, so our Prophet Muhammad sallallahu alaihi wasallam, and Allah said that दवाई के साथ dua zaruri hai. That means even in our faith it says with medicine you have to do dua, and both of them they're not either or. And so this concept has to be constantly challenged even within the fabric of our community.
Absolutely.
That if you pray harder you'll get better, or it's a punishment. It's not, because now we do have modern science, and modern science, if you really want to be sort of say, well, this comes from Allah anyway, this comes from God. I'm a person of faith, so I would have these conversations quite openly. But those who are agnostic or don't have faith, I mean, I know that these conversations will be very difficult. And we need to constantly challenge our concepts and our understanding behind that, because unfortunately we do package in our culture faith, culture with mental, psychological symptoms so much.
They're all linked, isn't it, in our
culture? They
are
linked.
And something else I think that you said earlier, and it really struck me, you know, in our culture, A, we're supposed to just grow old and kind of go away. B, like at a certain age, you're like, ek pair kabar mein, or you're like sitting in the corner looking after the grandkids.
Exactly.
That's your role, and that's it.
Now.
Finished.
No, you can't have sex
for your grandchildren.
Sangeeta,
no sex ever. No talking about it. No sex toys.
No talking about it. Yeah, you can't feel sexy either. You cannot.
Definitely not.
You just have to wear white or black.
That's it. No bright colors. Okay?
No bright colors. No earrings.
Red lipstick. I'm wearing red lipstick.
I know,
for those
it looks
can't.
beautiful. So you cannot wear color. You cannot even dye your hair anymore. No nail polish.
Nothing.
Because you're now old. Brapa again.
With my lathi. Yeah. No, but I think we're laughing about it, but this is the reality of our community, where we're supposed to grow old, and then as older women, I remember so many of my like aunties and all of this, like everything aches. Oh, my this hurts. Oh, my that hurts. This
Sar
sounds.
dukhta hai.
Sar
Yeah.
dukhta hai, pair dukhta hai, like constantly. And now I look back and I said, that was all menopause.
Yeah.
But that's the expectation, that somehow you grow old, you have no value, you have no life, and you've got aches and pains, and that's your lot in life. And then you're just supposed to shut up, put up, and die at some point. It sounds horrible, but that
And
is...
then put on top of that,
Yeah.
that you're as a woman now, because you can't exercise.
Yes.
Do you know what makes me most happy is when I see aunties jogging on the street.
Yes.
And now that's become a concept. And my mother goes for a walk every day. But I never saw that growing up, you know. When I started going to the gym, and I've been going on and off, and I still go to the gym badly, but I go to the gym and I started going, and as I said earlier, my father's the imam, and there was a massive hoo-ha. Ye gym jati hai mard ise dekhe, men will see her. And I specifically go to a gym where there's a women-only section.
Yeah.
And it's fine. But I remember being the only woman that used to go to the gym. Now, I mean, I work with a wonderful, wonderful group of women, and it's called Her Spirit. And please check them out on Instagram and get their podcast and follow them, because they offer free exercises. You could do it from home, and we worked tirelessly in the pandemic to get women of all backgrounds and communities exercising and moving, because we don't seem to understand that, you know, exercise is sometimes a taboo. She's jumping around. We can see her boobies jiggling about, or her fat is jiggling, and we don't seem to understand that. We sort of aspire to the Bollywood actresses who are but they work damn hard, and they do so much exercise, and exercise is something we're still really lacking in mainstream in our communities.
Massively in our community,
and so
Agreed.
We need to be making sure that we're pushing those messages that even if you're 50s and 60s, you don't need to have one foot in the grave.
Absolutely.
You literally still need to be doing exercise right till the last moment.
Absolutely. I was thinking this earlier. It's like half of the world's population will experience menopause. Like half of this planet. Yet there is such little information. I think it's getting a lot better. Your work, Davina McCall, Kate Muir, all of you are doing incredible work. But why do you think, even now, but this is, I think, within a small space, the majority of women that I speak to don't really, the menopause or perimenopause is not in their lexicon. It's not in their kind of mind space. Why do you think that is?
Because nothing is relevant to you until it happens to you.
Exactly.
And you know, menopause, you say half the population will go through it. It's been going through it for years.
Exactly.
Like since the dawn
of time.
Yeah. You know, Adam and Eve went through it.
Yes, Eve had it.
Probably why she ate that ruddy apple.
Bloody hell, I'm really shit. I'm going to eat this apple.
Just having a perimenopausal crisis. Sorry, I don't mean to be flippant and offend anyone, but we joke about. I mean, I think you have to joke about this, and you have to, because if you don't joke, and you get I'm as an individual who doesn't get angry. I get purposeful.
Yeah.
So I get annoyed, and I think, right, I need to change this. But for anyone that follows me, I try and contain my anger, because anger, I feel, now that I'm older, one, my 3 kids have taken all my anger out of me. I realize once you have children, you don't get angry anymore. You just think, right, this is, I've got a purpose, and let me be purposeful and help people and just do my little bit that I possibly can. And then somebody else will carry this on. And I'm a great believer in women lifting women. So I'm actually a loner. I'm not associated with any particular group. I'm an ambassador for various individuals, but lots of different individuals, different backgrounds. And I do a lot of stuff for free. And the concept is the fact that I want to support and empower women such as yourself. So you don't have a medical background, but I want to be able to give you the information for free so you can spread that to your followers and your listeners. And that's the best way. Margaret Fuller said that the best way to be an individual in your lifetime, or because I asked her, what makes you amazing? And she said, when you have knowledge, it's like having a candle. And then allow other people to light their candle for free in your candle. And then they follow that in. And so I do feel like I'm that sort of individual that nothing is mine. So all of this stuff that I'm saying on the podcast, it's not mine. I'm an NHS GP. I don't have a private clinic. I just want people to follow that knowledge on and pass it on wherever it might go. And that is the value that we bring as women, because women will tell you what they want.
Exactly.
You ask a woman anything, she'll tell you this is what I need to be better. Yeah. And that's why I love Women's Health so much, the beauty of Women's Health, because nothing is taboo for them. They actually don't become ashamed. We then have this concept that we think that women will be ashamed. And the other absolutely beautiful thing about women that I love is that if they have nuggets of information, any information, they will share it. They never keep it to themselves, especially if they think that this information will help others as well. And so it also has made me think, I need to make sure that we don't have the issues that we have now, because like you say, 50% of the population will go through menopause. But I don't want to be here in 10 years' time going, I wish my daughter didn't have to go through it. And this is where I have a lovely quote on my door, actually, in my surgery, by Colleen Hoover. She's a writer and she talks about cycles of pain. And she goes, we go through pain with periods, with childbirth, with everything. And she goes, well, I've seen my mother go through it. I am going through it. And I'll be damned if my daughter goes through this. And I think that's what spurs me, because I'll be damned if other women keep going through this, because we know where our flaws are. We know where our mistakes are when it comes to women's health. Those mistakes have been there for years. And what we shouldn't be doing is repeating those mistakes.
Absolutely. Absolutely. That's such a profound thing to say, I think. And I think it's really, really beautiful. Something I really wanted to talk about was women's health and how women's health seems to come up against patriarchal systems constantly. And you talk about this, I know. I talk about this in other work, but particularly. Do you think this is because the people making the policies are men and they don't go through what we go through? So therefore the policies that are created, they don't necessarily serve us.
Do you know what? I've given this a lot of thought. And I'm going to be a bit extreme. I'm not going to pin the fault on men. And you could say that I'm looking at the world in rose-tinted glasses. I'm married to a lawyer. My husband's a lawyer and runs his own law firm. And I'm the mother to 3 sons. And my boys are now 11, 7 and 3. We wanted to have a daughter. It wasn't to be in our in our life. And now we're done with our family. With our 3 boys we're very happy with. So I am the aunt to 2 nieces. And I've got 2 nieces. And I look at them and the way that they are is very different to my sons. But I'll be damned if I treat my sons any differently to my nieces. And I grew up in a house which was very much that the girls did all the cooking and the cleaning and the boys just sat there and, they wouldn't do very much. And I've learned that mistake. And I said, I'm not going to repeat that with my son. So my 11-year-old hoovers and cleans and they're completely aware that they need to do this. And I think I posted a little video of my son because he's really young and he spilt something. And I said, no, you're going to have to clean this. Yeah. And I think that comes with us as being confident and in our culture to say, there's no distinction between roles. We've made that distinction in our society because we made that distinction within our own misogyny of understanding girls, because unfortunately girls are sometimes seen as second class. And I see this often in my community. And I grew up with this, things that I would achieve are not going to be held up to a value compared to what a man will achieve. But that's not because of the man's fault. I think it's because of the perpetuating concept of what has come in generations and generations, and it's hard to see past that. So, for example, my father always says having a daughter is a bit like a burden because you're going to have to marry her off and she's now going to be someone else's. And the concept of property has been very well littered within all Georgian culture, Victorian culture, and still is so, because women have been bartered because of wars and civilizations have bartered over women like this. So when you're seen as property, well, where are your rights? Because, you don't, because your owner is somebody else. What we need to do is move past that and find allies within your community who are men and allies within women. So we need to stop as women going, right, if a woman comes and tells me, and I'm going to use an extreme example, that she's been raped, I will believe her. Yeah. Do not ever undermine a woman when she comes in with any problems which are gynecological related. So when it comes to women's health, if a woman tells me that I've got pain, I've got vaginal bleeding, I've been abused, or any of these things that are affecting a woman, the first thing you do is you believe her. Yeah. And you say, you say, I will believe you and I will validate that feeling. Because if we do that, and you're an ally, male or female, guaranteed we wouldn't have the issues that we do, but we don't have that yet.
Absolutely.
Even in America
100%.
right now, they're looking at abortion rules and
Yes.
changing that. A woman's biology and her body is the government's proper. I mean, where are our allies? Where are our individuals? And this is what a woke, highly intelligent Western civilization that we look to. So I think the great thing is that that's changing now. And so the rule makers, we need to support them, because when the woman comes to the menopause age and the decisions are being made, she should be there at the head of the table.
Yeah, absolutely.
You know, whether she's black, whether she's ethnic minority, whether she's Caucasian.
Yeah.
But I want my older women to be in the workplace, hence why I'm so passionate about menopause, because I want her to feel stability enough, her psychological symptoms and her vasomotor symptoms supported enough that she can then boss it in the boardroom.
Yeah.
That she's not the only woman there.
Yeah.
The number of times that I've gone into a room as a Pakistani hijab wearing Muslim woman, that they look at me and they say, "Tum cha banane aayi ho? Are you here to make the tea?" Even now.
My God.
And I work in This Morning and BBC Breakfast, and I often walk in and they are genuinely, I think that I'm there either as a cleaner or to make tea. And then I say, no, I'm actually the doctor here that's going to do the segment. And then this sort of ashened response and like clear embarrassment happens.
Wow.
It's because we still have that concept that there are certain individuals who shouldn't be in certain spaces.
Exactly.
As a woman of colour, why are you making a podcast? This is not your space.
Exactly. So that's, So there are these things that are put into us.
So the way you get around that is you formulate allies.
Exactly.
And you say, I'm deserving of this space.
Yeah.
So you could be somebody who, no offense to anybody, because I think all walks of life is up to, but somebody who works at a supermarket or a refuse collector.
Yeah.
Your value of your concept is based on you as an individual and what your views are.
Absolutely.
And if we see past that, then I don't think we'd have the issues, but we're not there yet.
It's a work in progress. Hugely, isn't it?
But it's a work in progress that unfortunately I might not see in my lifetime. We can try.
We're making a start. We're making a start. This leads me to, I would love for you, before we go, to give us some advice for South Asian women who are listening to you on Masala Podcast. What would you say to them?
So the advice I would give is, I would say the advice that I wish I'd had as a woman, and the advice that I will definitely give my nieces and daughters, who I might have daughters in the future, who never knows. So the first thing is never ever underestimate the value that you bring at any point in your life. You are just as valuable now as when you were 15, and you'll do just as valuable when you were 15, when you're about 90. Because what you bring is so important, and bring it to the table with all your glory and never hide it. Because when you start hiding the fact that I need to be a certain way to conform to individuals around you, your value is undermined. And be comfortable in the skin that you're in. So by that I mean that, so it's a big thing. But when I started wearing a hijab, the first thing that I used to get from my colleagues in the NHS was that you won't go further in your career because you're wearing a hijab. But I was like, but I need to wear a hijab because it's part of my faith, number one. And secondly, ye hum ghar mein karte hain. I distinctly remember never wanting to wear shalwar kameez outside the house. And it took a long time, but it was at university that I just thought to myself, why do I do this? Because I need to bring my full self.
Yeah.
I can't hide my colour. I'm sorry, but wherever I go, I'll still be the woman of colour.
Yeah.
I'll be brown wherever I am.
Yeah.
So own that brown.
Yes.
Own that brown colour. Own that hijab because your faith is important to you.
Yeah.
My faith is important to me. So own it. So do not ever feel that you cannot show the full you, who you really are. Because when you are the quirkiest, the fullness of you, people will actually value you, and therefore that value comes to the table and you participate and you offer something. So number one, never underestimate yourself. Number two, and this is what I would say to anybody listening, no idea is stupid and no question is stupid. So if I would say to my patients, you can ask me anything and I'll never say that this is a dumb question. And I say that to my children as well. Because you don't know the answer to something unless you ask the stupid question.
Yeah.
And then you don't know what you could be missing behind that.
Yeah.
Because So I always say no statement is silly and no idea is silly and no question is silly, because it's from that we actually find better research and better care and great ideas. Who would have thought that in the iPhone we would have the world in our palm? Because there was somebody stupid enough, Steve Jobs, who thought I could do this.
Yeah.
Do you see?
Yeah.
And now we're not laughing now. So no idea is ever stupid. Run with it. And lastly, get over your fear. Whatever fear that you have that you think, this is holding me back. Log kya kahenge? I hate that phrase. Oh my goodness.
Me too.
What will people say? That fear that we instill in our children from the moment that they're born. I mean, I grew up with that. Don't do this. Log kya kahenge? TV par kyun ja rahi ho? Log kya kahenge? Don't make a TikTok. Log kya kahenge? You're talking about vaginas. Log kya kahenge? I mean, I waved a coil on BBC Breakfast, and my mother phoned me straight after going, "Oh my God, Mrs. Khan is going to have a heart attack." And I said, "That's okay. I can see to her." But
luckily, I have the skills.
Yeah, I have the skills. No, I jest. But the fear is what stops a lot of women. But over that fear, get over that fear. And honestly, the world is your oyster. Once you're over that, and then you get past, that's the worst bit. And then you're just like, this is amazing, because honestly, life is so short. Yeah. Just do what you want to do.
Absolutely beautiful. Super inspiring. So, Nighat, you've got so many amazing things you do. You're on TV talking to us. You're on your TikTok. You're a GP. And I think before we started, I was saying, I don't know how you pack all of this in. But outside of all of these amazing things, is there anything else coming up that you want to talk about and share?
I do have some amazing projects, but I can't tell too much. So please do follow me on my social media, or don't follow me. I mean, I'm not that.
Do follow her. She's really amazing.
But I will have some projects coming up. I will hopefully have a book coming out at some point as well. And then, yes, more stuff with my TV work. But the core bit, and this is, I think, the most significant thing, is that my first love, and don't tell my children this, or my husband, is clinical medicine. At the core of it, I'm an NHS GP, and I think that I will find it very hard to ever move away from that. So for me, the greatest thing is I still feel relatively like a baby in GP land, and so I still feel I don't know enough. It's like jitna padhoge utna kam tum jante ho. The more you educate yourself, the less you know. So I'm in that sort of phase of mind at the moment that I feel the more I do stuff, the less I feel I know about stuff. Like, it only recently occurred to me that women who, in the British Sign Language, so women who are deaf, don't have a word for menopause.
Oh my God.
How crazy is that?
That is crazy.
The British Sign Language has words for everything, but not menopause. Huh. And we started doing telephone consultations in general practice. So how do I communicate with someone who's deaf on the phone because they couldn't come and see me? And it's only, so there's some work hopefully going to be doing around that. So it's things like that I just think, oh my goodness, this is, and I have a passion for learning and understanding things constantly. So no doubt I'll be learning a new skill at some point. So that will thrive me.
No doubt that you'll be doing some incredible things, even more than you already are. And I can't wait to see and hear all the wonderful stuff that I know you'll be creating. Thank you so much, Dr. Nighat Arif, today for being on Masala Podcast.
Thank you for listening.
It's been an absolute honor and a joy to have you.